Susan Spencer, CBS News, Washington.
Since the administration of the nation's second president, merchant seamen have received free medical care. But now the Reagan Budget Act is poised to trim and then eliminate this program, as Robert Shackney reports.
John Adams was president when the original law establishing government hospitals for merchant sailors was passed in 1798. But in 1981, the Reagan administration is questioning why the federal government should still be providing free medical care for seafarers. The maritime unions say it's a privilege that sailors have earned.
We do the same work that the Army, the Navy, the Marine Corps, the Air Force in time of war, and are not included in the GI Bill of Rights. So this is why I consider this not free service, but service that we're entitled to.
The service is provided in 8 public health service hospitals and 29 clinics around the country. But these days, only about 10% of the 13,000 seafarers treated each year are ocean-going mariners. The others are tugboat operators, crewmen of lake and river barges, offshore oil rig workers, and commercial fishermen. According to the Office of Management and Budget, their free medical care amounts to special treatment for a selected class of occupations that is no longer justified. With some of the maritime union's strongest allies in Congress defeated in the last election, the administration may win this argument. But the maritime unions continue to insist that their needs are special.
How many places deal with bubonic plague or other exotic diseases, rare diseases?
But administration officials say there are no longer enough merchant seamen to fill the beds of the public health service hospitals, that there are plenty of other hospitals with spare beds to provide the care. Closing down the public health service hospitals will have a price. This hospital in Baltimore also provides care for Coast Guardsmen, military servicemen and their families, and poor people in the neighborhood.
We can provide more services in one location than any place else in this area. The unique features of this hospital is that it's not just a hospital, it is a health system built around a hospital.
Because these hospitals treat so many other patients besides seafarers, closing them will not save the $900 million in the next 5 years the administration claims. Officials concede that 1/3 of the cost cover medical services the government will still have to provide somewhere else and still have to pay for. Robert Shackney, CBS News, Washington.
A coalition urged